Hello and welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so New Yorkers can improve their health. I'm Jimmy McKay, and I'm your host. Today, we're learning about acne. And remember, if you have a question or comments during the live stream, feel free to drop it in the comments below. To educate us about acne today is the Director of Cosmetic and Clinical Research at Mount Sinai Hospital's Department of Dermatology. Let's bring in Dr. Joshua Zeichner. Dr. Zeichner, welcome to Mount Sinai Live.
Hi, thanks so much for having me.
All right, let's jump into the questions, learning about acne today. What is acne? Let's start with the basics. What's it look like and how do you describe it?
Sure, acne is the most common condition that dermatologists see in the United States, and it's estimated that upwards of 50 million Americans suffer from acne every year. It's a chronic inflammatory condition of your oil glands, and patients develop blackheads and whiteheads, red angry bumps, and pus pimples, typically on the face, the chest, the back, and the upper arms.
Great description right there. All right, so let's move in some a little bit deeper. Causes. What causes acne? Family history, different factors that might come into play.
Sure. So acne ultimately is determined by your genetics. If you have at least one family member with acne, then you're more likely to develop it yourself. Acne is not an infection. It's an inflammatory condition driven by your oil glands. And there are four main factors thought to contribute to acne. Number one, oil. We know that patients with acne tend to make more oil or sebum than patients who don't have acne. And not only do they make more oil, but the composition of the oil is different. And it's that different composition that may actually thought to contribute to the inflammation that we see in the skin. Number two, we have sticky skin cells. We know that in acne patients, the follicles or the pores become blocked. So the skin cells stick together, forming a bottleneck, trapping that oil underneath. You can think of your face as having thousands of pipes connecting your oil glands to the surface of the skin. In patients with acne, all of those pipes are somewhat clogged, but we can't predict which ones will become clogged enough to form a full pimple. So those are the sticky skin cells. Number three, we have acne-causing bacteria, technically known as C. acnes or Cutibacterium acnes. This is a bacteria that's considered to be normal flora. So that means that it lives on the skin of everybody, whether you have acne or you don't. And this type of bacteria lives deep within the oil-rich environment of the follicle. And in acne patients, this bacteria promotes inflammation. And as I said earlier, acne is not an infection. Even though this bacteria is involved, it's an inflammatory condition. It doesn't mean that you're dirty and you can't spread it. And then finally, that fourth big factor is kind of the theme of what I've been talking about, which is inflammation in the skin.
All right, let's talk about foreshadowing. What are the signs of an impending breakout on the way?
Yeah, so we start to see acne in little kids when they go through puberty. The earliest stages of puberty involve maturation of the adrenal glands, known as adrenarche. And when your adrenal glands start to function, they rev up production of your hormones as you go through puberty, and that affects your oil glands. So little kids start to get blackheads and whiteheads in the T-zones. That's the forehead, the nose, and the chin, making a T like that. And that predicts that puberty is coming, and it may predict acne later in life. Other than that, in adults or in teenagers, you just need to follow the skin. And some people start to get little breakouts, and that may signal larger breakouts later. We know that acne is associated with environmental factors like diet and stress. There are studies showing that during testing periods, kids in school tend to break out because stress acne is real. It has to do with the hormones. And again, what you eat can also affect your skin.
All right, radio segue right there. You have my next question lined up. Let's talk a little bit more about diet affecting acne.
Sure. So when your mom said to you, lay off on the sweets or don't eat all that Halloween candy, she probably was right. We have mounting data showing that foods with a high glycemic index, these are foods that have high sugar loads, promote inflammation and drive oil production. We also have data showing that cow's milk, particularly skim milk, do the same thing and may be associated with acne. And finally, there's data showing that whey protein and vitamin B12 supplements may be associated with acne breakouts as well.
All right. So you brought up my mom, right? So mom always said, wash your face. Was she on the right page there? How important is washing your face?
So washing your face is important as in terms of daily basic hygiene. But the truth is, having acne doesn't mean that you're dirty. And there are plenty of people who wash their face regularly, but still break out. And then there are other people who don't wash their face and don't break out at all, because it really has to do more with your genetics. So at the end of the day, you can have acne with clean skin, or you can have acne with dirty skin.
All right. So let's talk about something else that goes on top of the skin, and that's makeup. Does makeup impact acne? Can a person use makeup if they have acne? Those are questions out there that are being asked.
So especially if you're breaking out, cosmetic camouflage is so important, because acne can really interfere with self-esteem because you're putting your face forward and this is what everyone sees. I tell my patients you definitely can and should use makeup if you feel self-conscious. I typically recommend mineral-based or powder foundations, because liquid foundations just have smaller particles and may block the pores a little bit more. And just because a makeup is labeled as long wear or 12-hour wear doesn't mean that you should leave it on for that long. So use it when you need it and then wash it off afterwards.
That's great advice right there. Let's talk about treatments. What acne treatments are available? What can people do about acne?
If you're suffering from acne, there are 3 main ingredients that you can look for over the counter. And this includes benzoyl peroxide, salicylic acid, or a topical retinoid known as adapalene. Benzoyl peroxide lowers levels of acne-causing bacteria on the skin and reduces inflammation. Salicylic acid is a beta-hydroxy acid that removes excess oil and dead cells from the skin to keep the pores clear and to dry the pimples out themselves. And adapalene is a vitamin A derivative, or a topical retinoid. And you can think of it like a pipe cleaner. It helps prevent those skin cells from sticking together to keep the pipes or the pores clear.
All right, here's a question that I had before we started, which is adolescents versus adults. Acne treated differently between adolescents and adults?
Yeah, so adult acne is a little bit different than the acne that we're seeing in teenagers. And while we do see acne in adult men, we're seeing a huge growth in the number of women that are breaking out with acne. And we refer to it as hormonal acne. A bit of a misnomer, because as I said earlier, all acne is driven by your hormones. But in adult women, we do see cyclical fluctuations of your hormones throughout the menstrual cycle. And as those hormone levels go up, they can stimulate your oil glands, leading to breakouts around the time of the menstrual period. And in adult women, we do have some hormonal therapies that your doctor can talk about to see if it's right for you.
Appreciate the information, Dr. Zeichner. Any final thoughts for the audience? Anything you'd want to leave everybody out there watching with?
Sure. So if you're suffering from acne and your over-the-counter treatments aren't working with regular use after a few weeks, make sure to visit a board-certified dermatologist for professional help. The one thing that I want to prevent in acne patients is the development of scarring, which can be permanent. And it can lead to divots or dents in the skin. And it can actually lead to a permanent emotional scarring, or can affect the way that you feel about yourself. So visit a dermatologist for help. And for more tips on acne and other skincare, follow me on social at Josh Zeichner MD.
And I love the take-home message that you share on Instagram, which is wear sunscreen. Very important as we come into the spring and the summer seasons as well.
Always, 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 always.
Dr. Zeichner, thanks so much for the insight. Find us at Mount Sinai NYC on all major social platforms. This has been Mount Sinai Live. We stream smart healthcare information that's simple to understand so New Yorkers can improve their health. I'm Jimmy McKay. Thanks for watching.